Strong emotions and intense pleasurable sensations in nursing mothers often lead to breastfeeding difficulties, even to cessation of breastfeeding.
Welcome to the A Different Kind of Psychiatry podcast, brought to you by the ACO. I'm Dr. Chris Burrett. Each episode features a narrated article, case presentation, or interview or discussion with one or more of our doctors who practice a different kind of psychiatry. We're interested in your questions and comments, and I would love to hear your feedback. Send an email to aco@orgonomy.org. The best way to help the American College of Ergonomy spread its knowledge is by letting others know about us. If you enjoy the podcast, we'd appreciate you leaving a rating and review. If you're interested in training with the ACO, you can learn more about the medical orgone therapy or social ergonomy training programs. You can connect with us and learn more at orgonomy.org. We have a new website, and we'd love to hear your feedback. This episode features the audio from the webinar Emotions, Sexuality, and Breastfeeding, presented by Dr. Theodota Chasapi. Breastfeeding can be a process of pleasure for both mother and child, and an expression of mutual love and an important basis for contact. It can cultivate a wide range of emotions and sensations that are common among mothers. Listen in to hear Dr. Chasapi discuss her patient Helen, who learned to allow and even enjoy sensations experienced through breastfeeding her son Philip.
Hi, I'm Dr. Susan Marcel, and welcome to the American College of Ergonomy's A Different Kind of Psychiatry case presentation webinar. I'm very happy to introduce my friend and colleague and our speaker today, Dr. Theodota Chasapi, and she's going to be presenting Emotions, Sexuality, and Breastfeeding. So Dr. Chasapi graduated from Aristotelian University of Thessaloniki, Greece, with an MD degree, and she's board certified by the Greek Board of Psychiatry and Neurology and is a clinical associate of the American College of Ergonomy. She maintains a private practice in Thessaloniki, Greece, and she lectures both in Greece and in the United States on perinatal care, natural childbirth, raising healthy children, love and work relationships, and the physiology of newborns, and other subjects. So, welcome, Dr. Chasapi.
Hello, Dr. Marcel. Nice to be with you today.
Yeah, so glad we could talk and do this together today. So before we start, I just want our audience to know that if you have a question at any point during the last, in the discussion, you can put it in the Q&A section down below on your screen. We will get to them at the end of our presentation, and then we'll go from there. So, Dr. Chasapi, why did you decide to present this topic?
I would like to reveal a dimension in breastfeeding that that is usually ignored. Strong emotions and intense pleasurable sensations in nursing mothers often lead to breastfeeding difficulties, even to cessation of breastfeeding. I would also like to show how medical organ therapy can help a nursing mother to overcome these difficulties and restore the love bonding with her child. Medical organ therapy is a unique therapeutic approach and offers an understanding of the natural processes taking place during breastfeeding.
So besides nourishment, what's the natural function of breastfeeding?
Contact. Physical contact, emotional, energetic contact between the mother and the child with mutual gratification, pleasure, sharing love. I would like to emphasize here the importance of the mother and her baby being together immediately after birth. There is a short period of time just after birth that is crucial for the mother-baby bonding. It is called the sensitive period. After an unmedicated birth, both the mother and her baby are alert, For the mother, the first minutes and hours after birth is a time where she is uniquely open to respond to her baby's needs, and the baby is in a quiet, alert, highly perceptive state. If they are left together in a warm, semi-dark environment, they can excite and attract each other. They share their love, they enjoy each other, and they can coordinate their actions, and then the breastfeeding starts, even by mothers who didn't intend to. There is the excitation reaches its peak during nursing. Both the mother and her baby are sharing a deep emotion of love, and the love relationship that started during pregnancy unfolds and deepens beyond any measure. The mother, without being told, knows how to hold and nurture her baby, and the baby knows how to reach and suckle his mother's breast. This seems to be true in all cultures all over the world. There is a deep response, a deeper level in the response of the mother, deeper than individuality, education, culture, or upbringing. The most energetical charged parts of the baby are the eyes, the mouth, and the throat. The baby reaches out to the world for gratification with these parts of his body. If the nipple of the mother is warm, erective, and alive, then the sensations in the mouth of the baby are so intense, so that sometimes we can see a quivering of the tongue, a soft trembling of the lips and the mouth. And this trembling can spread to the whole face, sometimes to the upper body, or it can spread to the whole body. The mother can feel intense, pleasurable sensations in her lips. These pleasurable streamings spread throughout her body, and sometimes they can reach the genitals. Whenever these sensations are intense, some mothers cannot tolerate them. And instead of pleasure, they can feel a discomfortable, irritable sensation and an overwhelming anxiety. And that's when the difficulties start, the breastfeeding difficulties start. That's what happened to Helen, the patient that I'm going to present today.
So when did Helen start medical organ therapy?
Helen started medical organ therapy when she was 24 years old due to overwhelming anxiety. She had recently been promoted to a very high responsible position in her company. And in the beginning, she was very happy because her role gave her recognition and status. But soon, her perfectionist led to overwhelming anxiety. Fearful of not making any mistake, she would spend hours working day and night, and she would be awake during the night trying to find the best solutions for her company. So this relentless cycle left her tired, exhausted, and she decided to start medical organ therapy because she was afraid she might experience a physical or mental breakdown. So at the same time, she broke up with a love relationship that a 2 years love relationship, and she was feeling sad and frustrated. Another failed love relationship she reported in her first session. All my love relationships start with a passion and end up in disappointment. Helen is a strong, active, highly charged organism. She's pretty, lively, energetic, sociable, engaging, and after several months, she was able to cope with her anxiety in her company, and her position was solidified. Several months after the beginning of her therapy, she met George, a handsome, charming man, and she fell in love with him. At that time, therapy was focused on her difficulty to stand genital sensations. She would, whenever her emotions or the genital pleasure were strong, she would cause arguments and fights to send George away. And she also reported that during the acme, the peak of the sexual encounter, she would freeze or be immobilized, disconnected from any genital sensations. Oh. Eventually, she was able to embrace her emotions and sensations, allowing her love relationship to evolve. A couple of years later, George and Helen got married, and soon after, Helen got pregnant. Pregnancy was thoroughly enjoyable for her. She enjoyed the contact with her fetus. The fetus was a boy. Philip was his name, is his name. And he was very active, responding to sensory stimulation from both parents. They would sing, dance, talk to Philip, and Philip would respond with active movements. At those times, both the parents were thrilled. And Helen said that this connection, deep bonding with her boy, made her feel strong and confident.
What a story. what a successful therapy, for her to go from being so dramatic and cut off into, to be able to feel all those feelings and have such a great connection with George and with Philip. So yeah. It sounds like she's much healthier.
She went a long way.
Yeah.
When she started therapy, she was that close to quit her job. She thought that she couldn't tolerate all the responsibility. But eventually, she was very successful, and she was enjoying her love relationship. And now she was starting her own family, and she was happy to be pregnant. So she decided to have a home birth with a low-profile midwife and with the assistance of George. The labor lasted long, but the pains were bearable. The whole process was smooth and nice. When Philip was born, was put on Helen's belly, and he was able to crawl and find Helen's nipple and suckle. Helen felt love, adoring her baby, the very moment that Philip raised his hand and looked her in her eyes. It was a magic moment, she described that. And she felt her love for Philip in her chest and arms. So they were enjoying their lives and they were happy together. So when Philip was 23 days old, Helen called me and asked for a session. She sounded worried on the phone, and she said that Philip had been biting her nipples the previous day, and in one occasion he cried loudly and angrily. She didn't know what to make out of this behavior, and she was anxious to find out what was going on with Philip. So the next day, she came to my office, holding Philip in her arms. She looked happy and excited to have her baby in her laps, although her eyes were worried. Philip was sleeping with a face of satisfaction, and he appeared relaxed. So Helen described the situation. She said that she cheered the birth, and she was happy nursing Philip. Philip seemed content after the breastfeeding, and he appeared relaxed, and Helen noticed that sometimes he even smiled during his sleep. Breastfeeding was on demand.
Wow.
And Philip...
Dr. Chasapi, what does breastfeeding on demand mean?
Means self-regulation. There is no time schedule, and Philip was the one to reach out to his mother and ask to breastfeed him for nourishment, but also for comfort.
Okay.
And Helen was able to respond to his call. She said that Philip didn't cry. Helen was able to watch and observe the body movements, the movements that he did with his mouth, some baby talk, signing that he was calling his mother to breastfeed him. The milk flow was excellent, and Philip was growing up without losing any weight in the beginning.
Oh, that's amazing. And usually babies lose weight, right?
Yeah, yes, they do. But whenever the birth is without stress and the mother is not worn out or tired, then the milk flow happens like in a few hours. And the baby and the growth from the uterus doesn't stop, and the process of development is excellent. So she said that although everything was fine, she could not figure out what was going on with Philip, biting her nipples. Philip now was awake, and Helen put him on the therapy couch. She addressed him, and Philip looked well developed. His skin was pink, and his hands and feet were warm, and he appeared relaxed and bigger than his age. When I spoke to him with enthusiasm, he responded with a smile. And he was able to follow my movements around the room. So when I examined him, his chest was held, his breath was not full, and there was some tension in his jaw. When I pressed his jaw, he expressed anger with loud, angry voices. It was so intense that Helen was shocked. Why is he so angry? She whispered. After Philip expressing his emotions, he was relaxed and his breathing was full, his breath going down to his pelvis, which moved forward during its exhalation. So that was the first session of Philip. He was 24 days old and he had already his session. His holding of his breath and the tension in his jaw were an indication that he was holding back emotions, anger.
Okay, so that's a form of armoring in a way. Like he was holding back the emotion in his jaw and in his chest.
Yes.
Yeah. So what happened next?
So after he felt relaxed, he started babbling a nice baby talk, calling his mother to breastfeed him. So the mother held him tenderly in her lap and offered her breast. Philip opened his mouth wide, latched on the areola, and started suckling vigorously. I was able to observe a very nice, healthy suckling. He was using the deep muscles of his throat. His jaw was moving slightly up and down, and I could feel and sense the pleasure that he felt. Helen was looking in his eyes, and Philip was looking in her eyes, and they were sharing a deep feeling of love. It was a pleasure for me to watch them.
How beautiful, how beautiful.
So Philip nursed for a while, and then I noticed that Helen started tapping her foot nervously. You are tapping your foot, I whispered, not to disturb them, the nursing. She looked at me in surprise and then noticed her foot, and by holding her breath and cleansing her jaw, she tried to stop the movement. I'm not telling you to stop. I'm just telling you to be aware of what is going on in your body, I told her. Please open your mouth and deeply. She did that. She took a deep breath, but then cleansed her jaw again. Now the tapping became more intense, more quick. And then I observed that in a while, she, without Ellen recognizing it, she pulled her breast away from Philip's mouth. And Philip reacted immediately and latched on her nipple and suckled vigorously. Ellen pulled her breast even farther, and Philip acted out immediately. He latched on the areola, and in an attempt to hold the nipple firmly, he bit it. Helen screamed out loudly in pain. What is going on? I asked her. See, she said angrily, he just beat me again. My nipples are so throat. Now Philip was screaming and crying loudly. Helen burst into loud tears, and they were both crying on top of their lungs. The room was full of their intense cries. So Helen handed me Philip, and I asked her to lie down on the therapy couch, let go, and breathe deeply. Then I turned my attention to Philip. Philip, with his eyes closed, his mouth trembling in desperation, was crying loudly and angrily. Holding him in my arms, I felt a nice, sweet, warm feeling, and I felt love for him. I started talking to him with warm, loving words, reassuring him that everything is going to be fine, that his mother just needed to cry. He seemed to listen and sense my love for him, and he opened his eyes, wide, bright, tearful eyes, and looked at me. Excited by his look, I continued to talk to him, and he responded to me with a nice baby talk. That was a very intense emotional connection with him. He felt my love for him. He felt that I was not anxious, and he calmed down, and I could feel his breath reaching down to his pelvis, and his breathing was full now, and he seemed relaxed. Then I turned my attention to Helen.
Mm-hmm.
I let go. I encouraged her to express her feelings. She looked very angry. She hit and kicked and screamed. I can't stand it. I can't stand it anymore. Expressing all her rage. After she had expressed her rage, she seemed relieved. She looked worried at Philip. Philip was now calm and relaxed, and I told her, "Don't worry, Philip is okay." She burst into tears once more. With a very dramatic way, she started saying, "Oh, what have I done to my baby? What have I done to my baby?" In a very dramatic way, disconnected from her own feelings. "Your baby is okay," I said firmly. "Let's see what is going on with you," I said loudly. She stopped the complaining and the crying, and she took some deep breaths and looked seriously to me. I asked her, "What have you been feeling?" She said, "I feel shame and guilt. The last couple of days, whenever Philip is nursing me, I feel these unbearable, pleasurable sensations that start from my nipple, spread to my whole body, and reach down to my genitals. They are so intense that I can stand them. The pleasure turns to unpleasure, to discomfort. That's what I felt before, when Philip beat me." "And what did you do?" I asked her. And she looked me in surprise, and it was at that very moment that she realized that she had pulled away her breast. So that was a very good moment that she became aware of how she was handling the intense, unbearable sensations. I asked her to breathe deeply and let go. Once more, she started kicking and screaming, saying that I can't stand it. I cannot stand them. I just cannot. And that was very relieving for her. And then she said that she became dramatic again. And she said, "I feel so ashamed to feel genital sensations during breastfeeding." I told her that it's absolutely normal, natural to feel these sensations, that many mothers feel the same way, and that she can feel joy and pleasure during nursing, and this is okay. She looked at me in utter surprise, never heard of such a thing before.
Yeah, that's very, very common, that there's a full range of emotions that can be felt throughout nursing. So you were addressing her defenses and helping her realize how she was handling that emotion.
Yes. And then she turned to Philip, observed that he was calm and he was sleeping in my arms. And she said that I have to think about all this. She took gently Philip in her arms, and she left my office, arranging to come again next week.
Mm-hmm. Yeah. So what happened then?
So next week, George came with her. George was holding his son in a baby carrier. and he looked shiny and happy to hold his baby, and Philip was relaxed. And Helen, this time, was very determined. She stepped alone in my therapy room, treatment room, and said that I am the one who needs to have a session. I am the one that creates the problem. So she lay down on the therapy couch, took some breaths, and she reported that after the previous sessions, she felt relieved. And the knowledge that these sensations are natural liberated her. She became aware of her difficulties in breastfeeding, and she felt like the old problem came back again. Strong genital sensations were causing the problem. She said, I am aware that at those times I clench my teeth and I hold my breath, and that helps because I consciously try not to pull away my breast. And Philip is doing well. There were only a couple of times that he beat me. So therapy was focused on her difficulty in tolerating strong emotions. And during the sessions, sometimes I pressed her jaw to release anger, and she would kick and hit and express the frustration or whatever was there. And eventually, she solved this problem, and a couple of sessions later, she said that she had a very gratifying sexual encounter with George. And she asked me to examine Philip. And Philip looked very healthy. He didn't have any holding or tension in her jaw, and he looked like he was not intact anymore by the whole situation.
Mm.
So that's how.
What a story. So why did the old symptoms reappear at that time in Helen's life?
It was because when she was pregnant and she was excited by Philip, the energy charge was raised. Her body was soft, and she was more sensitive. She felt more. And after the birth, the pelvis opened, and she was feeling more in her genitals. And the excitation every day through nursing Philip charged her even more. So that ended up in feeling more, in being more sensitive, in being more charged emotionally.
Hmm.
That's what.
And then she was able to release that emotion in therapy.
In her sessions.
In her sessions. Yeah. Yeah. And then it unblocked both of them, it seems, from the way you're describing it. Yeah. What a great story. Yeah. Is there anything else? Because there are some questions from our audience. Anything else that...
No, let's go on to the questions.
Yeah, let me see what we have here. Here's the question. How old was the fetus when it was first reacting to the stimulation? From
5 months old.
5 months. Okay.
That's a time when the fetuses start moving and the mother is able to feel the movement.
At 5 months,
So whenever the connection between the mother and the baby is good, then the mother can feel the reaction of the baby, can call the baby. Not only the mother, but also the father.
The father, sure.
Can do that, yeah.
Sure. So there's a question, how do mothers bond privately with their babies if they have a C-section?
Oh, so they can ask from their obstetrician to have the baby on their chest immediately after birth. And the physical contact, skin-to-skin contact, always help them for the bonding.
Good, good. Another question, how young do sexual feelings start in an infant?
Say it again, I didn't understand the question.
I will guess in an infant, at what time do they start feeling sexual feelings?
Around the age of 4.
Mm-hmm. 4 years old.
4 years old, yes.
Right.
Genital feelings or sexual feelings or pleasure in the mouth or...
Right. So there's pleasure in the mouth and the throat, and then as the baby
there is
matures.
pleasure in the mouth, in the throat, immediately after birth.
Right.
During suckling.
Right.
Yes.
And then
and that lasts for about 18 months. That's for how long the energy starts in their mouth.
Mm-hmm.
And then the energy moves down to the genitals.
Right. There's a question, what if a mother is pregnant a second time and wants to breastfeed her first child?
Oh, yes. Some mothers choose to continue breastfeeding their child during the whole pregnancy. And then when the baby is born, then they decide to breastfeed both of them.
Right.
And they can enjoy the breastfeeding with the 2 children.
Mm-hmm. Yeah. I mean, I often think about like a mother that has twins or triplets.
Oh,
What's that like? I don't know if any of our audiences that has that experience, but how does a mother who's had twins? Have you ever treated a mother that had twins?
yes, I did. Yeah.
Mm-hmm. And how was breastfeeding for them?
Breastfeeding for the mother it needs a lot of work because each child is asking for the attention of the mother.
Right.
And sometimes there is a fight between them.
Yep. Yeah. And there's another question. Some women have orgasms during nursing. Was the woman able to release her highly charged sexual genital feelings with her husband? And I think the answer is yes. Yeah.
Yes.
Yeah. Yep. Here's another.
Helen, yes.
Go ahead. Sorry.
Helen reported that she had satisfying sexual release with George at some point in her therapy.
Mm-hmm. There's a question. How do you know when to wean your baby from breastfeeding?
Oh, so there is not a time schedule for that because weaning is a whole process. It's not a single event that happens once. It is not a separation. It's unfolding the love relationship between the mother and the child. The mother facilitates the child to be independent, and she can use other behaviors instead of breastfeeding the child so that the child can develop and go out of her lap and leave her lap. Whenever there is a good contact between the mother and the child, the mother knows when to start weaning. Weaning needs not to last for a long time. It's a whole process. For example, instead of the mother, instead of offering her breast in order to comfort her baby, she can hold the baby, kiss the baby, say tender words, or instead of breastfeeding the baby before sleep, she can read the story to the baby, or the father can put the baby, it is not baby, the infant, to sleep.
Mm-hmm. Yeah. Yeah. Here's it's a longer question, but I'll read it to you. Dear Dr. Chasapi, my second daughter is now 2.5 years old and is still breastfeeding. Until recently, this felt comfortable and manageable for me. However, I have started to feel increasingly frustrated and very tired. I sometimes feel guilty about these feelings and wonder whether this is a normal experience. Do you have any comments about that?
Yes, yes. Yes. It needs two to tango. Breastfeeding is mutual gratification. So whenever the mother is feeling tired or she feels that she needs to stop, then this is the time to stop. Of course, this needs to be gradually, not to create a trauma to her child. 2.5 years old is a good period to stop, because the energy from the mouth moves down to the genital, and the child is in the next stage, goes towards the next stage of development. So around 3 years of age is a good period to stop. But I repeat, this must not be immediately. It needs to be gradually.
Yes. Yeah, I would agree with that. Another question, what has been observed in other mammals with regard to nursing?
Oh, there are many different stages. I don't know how to answer this, but observing mammals, it's a good opportunity to observe how naturally they function. This last summer, I was able to observe a wild cat with 5 kittens.
Oh my.
And that was for a long period of time, almost more than 2 months. And I could observe that she was playing with the kittens, but also pushing them away, giving them opportunities to become independent, to develop. And that was amazing to observe. It was a good observation to use it also for the humans, because for some mothers, breastfeeding is so pleasurable that they feel and they need to hold on to the baby, and they don't let him grow up and leave her lap. So.
Right. And there can be a sadness to that in the mother, I imagine, that closeness, but that the child, their relationship evolves naturally as it should. That the mother's this kind of secure rock, and then, the child can go out and explore the world and then come back to the mother, and that gradual process of weaning can happen. But the mother has feelings about that, sure. And to have an outlet for those feelings, like therapy. So there's other questions. What do you recommend regarding using a pacifier in an infant?
I do not recommend it.
Right. Yeah. Can you say why?
Yes. For mothers who breastfeed, they don't need to use a pacifier, because pacifier is not a neutral object. It's an intrusive element in the emotional life of a child. If it is used to calm down a baby that is crying, it's a way to repress the feelings, instead of trying to find out what causes the crying and solve the problem. If the pacifier is used early in an infant, it produces a confusion of the nipple, because the mother breastfeeds the baby with an alive, warm nipple, and there is physical contact and satisfaction between the mother and the baby. And with the pacifier, with this plastic cold thing, it is like they put a stop in their mouth in order of them not to feel. Of course, there are some indication of when to use the pacifier, but these are very rare situations. The pacifier is not a way of taking care of a child.
Yeah, there's another question, Dr. Chasapi. What problems appear in child development if the mother breastfeeds the child when they're over 3 years old?
At that age, around the age of 4, the child is in a stage of development where the energy is down to the genitals, and the baby is attracted to the parent of the opposite sex, and also is interested in children of the opposite sex. So if the mother is holding the baby and breastfeed it, then that produces a confusion.
Okay. And so you would recommend weaning by the age of 3?
Yes.
Yes. Yeah.
The most.
The most. Mm-hmm. There's a question about, should babies sleep with their mothers?
Of course, they do sleep with their mothers when they are infants and they are born. It's very comfortable and natural. The skin-to-skin contact. Some babies sleep for 2 months on their mother's chest, sometimes on their father's chest.
Mm-hmm.
And it's very natural. But of course, when they grow up, they need to be independent. And the mother knows when the baby feels ready to be independent.
Yeah, boy, we have a couple more questions and we are going to have to wrap up soon. But what is the youngest baby you've ever treated with medical organ therapy?
2 days old.
Wow. And there's a question of, what do you tell a mother who's unable to breastfeed?
So the most important thing is the physical and emotional contact between the mother and the baby. If the mother holds her baby, looks at the baby in the eyes while using the bottle, then the emotional connection will be satisfying for both of them. They need to carry their babies a lot of hours during the day for the physical contact and to love them. And if they love, then if they love their baby, then the baby feels the connection, and it's very nice for them. Sometimes breastfeeding done in a mechanical way has the opposite results. The most extreme case that I ever treated was a mother who had a daughter 3 months old, and the daughter refused to breastfeed her. The mother was very determined to do that, but she did the nursing in a very mechanical way, on a schedule, 10 minutes in each breast, so that the baby, instead of receiving love and comfort, was receiving frustration and disappointment. And at the age of 3 months, decided to have a nurse strike. She didn't want to nurse anymore. And although the mother was determined and said, I'm not going to give the bottle, she will start eating at some point, I advised her not to do that. Just give the bottle.
Mm-hmm. Yeah. Well, Dr. Chasapi, we have many more questions, and I guess I just want to tell our audience, I think we need to have another webinar in the future, because this is a lot of good questions and comments, and I think we could continue this discussion, but our hour's almost up. So would you be willing to come back and we can have another discussion?
It's with pleasure.
Yeah. No, the questions have been great. The comments great. And, is there anything else that you want to say before we come to a close today?
Yes, I encourage mothers-to-be to insist on being with their babies immediately after birth. This is very crucial for the mother-baby bonding, to trust their body feelings and to enjoy the pleasure that contact and breastfeeding is offering to them. This is a fundamental basis for the emotional and physical health for both of them.
Well said. Well said. Well, thank you. Thank you so much, Dr. Chasapi, and thank you to the audience for the great participation and questions. It's a very exciting topic, and I appreciate all the work you did and with the family that you helped. So to be continued.
Thank you very much.
Yeah, so thank you.
It was a pleasure.
Same here. So, and I guess I would just like to say a special thank you to the donors of the ACO, and they all make this work possible for us, and to all of you wonderful audience members, your questions and comments. I hope you'll come back for our next discussion, and we'll let you know when that is.
How do you feel after listening to Helen's story? How do you feel about the questions and talking about sexuality and pleasure with breastfeeding? What do you think? I was moved to hear Helen's story of overcoming her pleasure anxiety and enjoy herself and her baby while breastfeeding, and I was struck by how simple and straightforward Dr. Chasapi was in working with her. I hope mothers listening take Dr. Chasapi's words to heart and advocate for what they feel is best for themselves and their babies. The best way to help the ACO spread its knowledge is by letting others know about us. I hope you'll share this podcast with your friends and family and let them know about our work. You can connect with us at orgonomy.org. I'm Dr. Chris Burrett. Thank you for listening to the Different Kind of Psychiatry podcast brought to you by the ACO. Since 1968, the psychiatrists affiliated with the American College of Ergonomy have been helping patients discover greater satisfaction, health, and overall well-being in their lives, whether patients suffer with mental illness, struggle with addiction, or feel unsatisfied with their work lives or relationships. Medical orgone therapy, as practiced by the physicians at the ACO, offers a way forward, often without the use of medication.